So a question I got recently is there such a thing as an areola reduction? And you've guessed it, of course there is. So in a lot of different surgeries, such as a breast lift or a breast reduction, we typically end up doing this because usually, particularly if the areola is very big and we're reducing down the size, well, that is going to help lift the breast on the chest. Or if we're doing a gender affirmation surgery, for example, obviously, let's say female to male or non-binary, we're going to want to maybe masculinize that nipple, so greatly reduce down the size of the areola. So just depending on what the patient's goals are, there are different ways to do it. I have had patients who just the areola itself is the part that bothers them the most, and it is possible to reduce that down. So typically, let's say in a female breast, we'll do this with an incision around the areola. The only caveat is sometimes the areola may increase in size again if the scar stretches somewhat. This is typically when we're trying to remove a lot of skin, and a lot of surgeons don't like to use that incision alone for a breast lift for that reason. But typically, we can reduce the areola, and also this will tighten up the skin in the breast and at the same time lift it and make it a little bit more perky. Just depending on the shape of the breast in the first place, we may want to do a more extensive scar in order to lift the breast or reduce it, but we can do an areola reduction by itself.